Good morning, guys! Today is a big day for me and my mom, especially my mom. So my mom's here in the car with me. How are you feeling?
I'm nervous.
Nervous?
Yeah. I'm really nervous.
We don't have to do this. 하지 말까?
No. I wanna do.
You wanna do it?
I wanna do.
Oh,
make
okay.
a pretty woman.
But you're already pretty.
Yeah.
You're already pretty.
Hi.
You're already pretty.
Maybe next 2 weeks later.
2 weeks later what? What was that? 2 weeks later what?
Change my face.
Yeah, so we are in the car, guys. We're headed toward Gangnam to meet Tony. He's gonna hook us up with some good stuff today. And my mom has not been eating for the past 8 hours. She hasn't been drinking or eating, so she's not in the best mood, but she seems like she's in the best mood. So let's go. Bye. We are here at Answer, and it was recommended by Tony from Seoul Medical Guide. My mom went to go change. I am going to make myself some coffee.
왜 그러세요?
귀여우시네요.
Please. No more. 그러면서 please.
아유, 여기가 쫙쫙 펴지시겠네요.
어디요? 아, 여기요.
네.
이게 이렇게 될 거고요. 여기도요. 이렇게 될 거고요.
그 막 튜브 밑으로 이렇게 하는 게 아니고 그냥 주사로. 안녕하세요.
저렇게 늙었어.
그렇게 생각보다 그렇게 많지는 않거든요. 이렇게 눈을 잘 못 뜨고 계시고 여기를 잘 뜨게 하니까 또 여기가 또 처지고 필요하면 눈 뜨는 힘도 약간 중간에 보강할 수 있습니다. 그래서 좀 실로 이렇게 들어가서 이렇게 4포인트 정도 당기는데 이 광대가 좀 많이 나와 계시죠. 이렇게 하면 광대 아래쪽이 좀 많이 꺼져 보일 수 있어요. 실로 당겼을 때 광대가 좀 발달하신 분들은 이 아래쪽에 약간 좀 들어가고 있는 느낌이 좀 지속될 수 있습니다.
지금은 좀 마음이 조금 편해져.
그래?
그냥 굉장히 꼼꼼하게.
그러니까 소감이 어떠세요?
Right now it's just a little bit
Nervous?
relaxed.
Relaxed? You're relaxed more now?
Just because doctor is feeling good.
Oh, doctor was very... He took his time for sure.
Yeah, it's very 꼼꼼.
Yeah, so...
I'm trusting him. That's
You
why
trust
so
him?
I'm comfortable.
Good. Good. We're ready? We're ready?
Yeah.
They're gonna take us in now.
Yeah.
Okay.
See you soon.
Alright, I'm gonna go with you. I'm gonna go with you.
이쁘게 하셨는데.
Okay. 엄마. 하그 한 번만 하고 가.
오케이.
잠시만요.
알겠다 와. 오케이. 바이. It's like sending off my kid to the first day of school or something. Hi, this is Tony from Seoul Guide Medical. He's the CEO. And he's gonna take care of me and my mom.
Yeah, we're gonna take really good care of her. So she's getting started, but I want to explain what the procedures are.
Yeah.
So she's going to receive 3, possibly 4 different procedures. The first one is a kind of facelift called surgical string lift. 4 strings are inserted into the side of the head here and into the side here, but it's all hidden along the hairline. These are not the non-surgical ones which dissolve into your body. These permanently stay in your system, and they hold the lift for years and years to come. In terms of the lifts that are needed, you have full surgical smash lift, which is, you know, the biggest one, but your mom actually has pretty good skin for her age and doesn't need it. She looks great right now, but she'll look better after the procedure. After we do the string lift, the doctor's also going to do medial epicanthoplasty, which is this little Mongolian fold here, it's called, and it's going to make the eye look a little bit bigger this way.
This way.
Yes, towards the inside to provide balance. The next procedure is the double eyelid area, and he's going to be doing something called blepharoplasty, where we cut out excess skin.
Yes.
The problem is that as we age, we get more skin drooping down here. It closes our eyes, and it actually forces our forehead to lift up. So I'm going to try to do it. And when we lift up like this, we have lines in our forehead.
Right.
So this will actually stop your mom from forming these lines in her forehead. It's going to help her in the future as well.
Cool.
Then, if necessary, the doctor is going to perform ptosis correction, which is a similar kind of procedure, but it's a fold. So blepharoplasty removes the excess skin, and ptosis correction creates a better fold in order to open the eye. Ptosis correction is basically when the upper eyelid skin covers part of the pupil of the eye, which makes your eye look smaller, and again forces your forehead to work double. Right. So that's it. It's not under general anesthesia. She was a little worried today it was under general anesthesia. Yeah, it's local with sedation, which is safer than general, but although general is quite safe anyways. Any questions you have?
Will my mom be okay?
Yeah, your mom's going to be fine. We've done this procedure a lot.
Right.
She'll wake up in a few hours. We'll bring you back to say hello. And in about a week, she'll feel a lot better. She'll look a lot better. And within a month, her face will be more or less recovered. Full healing takes 6 to 12 months. But after about a month or so, you're pretty much good to go.
All right. Hey guys, I'm just gonna lay in bed and take a nap while my mom is in the surgery room. She's gonna be in there for about 4 hours. So it's 11 right now. I'm just gonna stay here and not go anywhere because I'm too nervous to go anywhere else. Yeah. Good night, guys. So it's about 2:15 right now. She was in the surgery 3.5 to 4 hours. She's doing well. Just putting ice on her eyes. I'm just glad she's okay. 어때? 하길 잘한 것 같아?
네.
기대돼?
네. 지금 뭐 I'm so ugly. 트윅스 레이어 되게 예뻐질 것 같아요.
엄마 이것 때문에 스트레스 많이 받아 했잖아.
네.
잘 됐네. 의사 선생님도 좋은 분 만나서 다행이고.
I'm lucky.
Yes, you are. You're lucky.
호박죽 줄 거는 먹을 수 있어요?
네.
Look at Tony doing everything.
It's your mom.
Thank you. First class service. 지금
서비스가 아주 좋네. 눈에는 가면 안 되죠?
네, 눈만 이렇게 안 감시면 돼요. 여기 지금 어차피 구멍 냈잖아요. 그렇기 때문에 이제는 이렇게
3일 있다가
그게 제일 좋아요. 실리프 때 하겠습니다.
눈 이제 쉽게 잘 떠지시죠? 이게 막 힘 안 주셔도 눈 잘 떠질 겁니다. 지금 좀 부어 계셔서 그런데 그 앞트임 하셔가지고 안경 여기 누르시면 안 좋거든요.
이렇게 할게요.
예,
앞트임도 했구나.
멀리 좀 되셔가지고 여기는 수술한데 여기 직접 누르지 마시고 좀 잘 되셨어요. 그리고 실로 당기는 것도 잘 되셨고 내일 치료받으러 오시면 돼요.
감사합니다. 붓기 많이 빠졌네요.
네, 거의 다요.
멍도 빠졌네요. So we are at Answer again. And she is here for her checkup. She's gonna get some cleaning done.
It's okay.
Everything okay.
Everything's okay. I can see your cheekbones more.
Yeah.
It's more lifted. Okay. Sorry?
This area right here is below.
It's still swollen.
Swollen.
So we'll ask the doctor what it is. Sometimes it's swelling, sometimes it's jibang. Happens when you inject more fat into one area. So it takes a while for, only half of the fat survives. So if we inject 100%, only 50% will survive. so we need to inject a little more than necessary. You look pretty.
Right now I'm waiting for my mom until she gets her medicine. And she got all her stitches out, so now she could start showering. I mean, she showered before, but she usually had like this thing where she covers her eye, but she doesn't need that anymore. So she can now comfortably shower.